Hello, I'm John Jose from the University of Miami, Division of Musculoskeletal Radiology. We're going to be discussing basic MRI anatomy of the ankle. This is an axial proton density image of the ankle, and let's start by reviewing the regional osseous anatomy. As we go from proximal to distal, we have the tibia and the fibula, and the distal tibial plafon. We see a gray smudge, and that delineates the tibio-talar joint line, and that's going to be an important landmark for us when we evaluate the lateral ankle ligament, which we'll be discussing shortly. But as we extend distally, we see three separate osseous structures. This is the medial malleolus, this is the talar dome, and this is the lateral malleolus. As we follow the talus more inferiorly, we get into the talar body. This is the talar neck, the talar head, and then right by when we start seeing the talonavicular joint and the navicular, we also get into the calcaneus. We're past the level of the subtalar joints. We see a portion of the sustentaculum talus, and then as we extend further down, we see more of the body, the calcaneus, and eventually the anterior process. More anteromedially, we see the navicular and the navicular cuneiform articulations, and these are the three cuneiforms, the first, second, and third. As we scroll more inferiorly along the lateral aspect, we see the cuboid and the calcaneocuboid articulation. And then more anteriorly in our field of view, we see the bases of the metatarsals. A lot of the structures that we'll be following through the ankle will insert into the bases of the metatarsal, so we have to evaluate them carefully. So within our field of view, we'll see the first, second, third, fourth, and fifth metatarsal bases. The fifth metatarsal will have this bony protuberance called the tuberosity, and then at the tuberosity, the peroneus brevis, lateral cord of the plantar fascia, and peroneus tertius may attach. When we look more posteriorly, we have our largest tendon, which is the Achilles tendon, and usually we catch some of the inferior fibers of the soleus, which tends to insert more distally at the myotendinous junction. The Achilles does not have a tendon sheath, so cannot have tenosynovitis, and so it does have a paratene on when you see inflammation in the setting of Achilles tendonitis. Medially, you'll see a small separate tendon, often, which is a plantaris tendon. The plantaris originates distally in the femur, above the level of the knee joint line, and it goes from lateral to medial. So it goes from the lateral aspect of the distal femur, and then it will travel medially to insert medially onto the calcaneus. So here's a nice view of the body of the calcaneus with the Achilles insertion. When we look posterolaterally, we see the peroneal tendons. The peroneus brevis will be closest to the lateral malleolus. The peroneus longus will be posterior to that. And you commonly see a thin strip of tissue that helps to stabilize the peroneal tendons at the level of the lateral malleolus. This is the superior peroneal retinaculum. You may also see additional or anatomic variants in this location. The classic accessory muscle is the peroneus quartus in this location. Difference being that the peroneus quartus will travel more inferiorly, while the peroneus brevis and longus will extend anteriorly past the level of the lateral malleolus. The peroneus brevis will insert into the base of the fifth metatarsal, while the peroneus longus will insert into the lateral base of the first metatarsal. And if there is a peroneus quartus, it will go inferiorly to insert into the calcaneus. At the level of the body of the calcaneus, we see the inferior peroneal retinaculum that helps to stabilize the tendons at this location. We also have two very important bony landmarks. The first lies posterior to the peroneus longus, and that is the retrotrochlear eminence. We also have a second bony protuberance that lies between the peroneus longus and brevis, and that's the peroneal tubercle. The peroneal tubercle will demarcate where the common peroneal tendon sheath will split into the sheath for the peroneus brevis and the sheath for the peroneus longus. If it becomes hypertrophied or enlarged, the peroneal tubercle can lead to peroneal tendon dysfunction. So there's the peroneus brevis, and we'll follow it towards the base of the fifth metatarsal, where it will insert more laterally. There's the peroneus brevis. Now, if we look more inferiorly at the tubercle at the base of the fifth metatarsal, we'll see this black structure, which is the lateral cord of the plantar fascia attaching into the more plantar aspect of the tubercle. So you can imagine if you have an avulsion fracture in this location, it could involve one or both, either the lateral cord of the plantar fascia or the peroneus brevis at their distal insertions. Now dorsally, you can have attachment of the peroneus tertius. The peroneus tertius will originate from the anterior aspect of the fibular diaphysis and the interosseous membrane insert right there. The peroneus tertius will originate from the anterior margin of the distal fibular diaphysis. So again, here's the peroneus brevis and lateral cord of the plantar fascia. Now, when we look posterior medially, this is the location of the long medial flexor tendons of the ankle. The three main ones are the posterior tibial tendon, the flexor digitorum longus, and the flexor hallucis longus. And as you notice, the flexor hallucis longus will travel from lateral to medial, while the flexor digitorum longus will travel from medial to lateral. And where they cross distally is known as the masternut of Henry. There is the posterior tibial tendon. As we extend distally, the main attachment of the posterior tibial tendon will be the medial border of the navicular, but it also has smaller attachments along the plantar aspects of the first, second, and third cuneiforms, as well as the plantar bases of the second through fourth metatarsals, and also some fibers will reach the cuboid. All of these tendons are held in place by a flexor retinaculum, similar to when we discussed the superior peroneal retinaculum covering the peroneal tendons. We have a flexor retinaculum, and then between the flexor hallucis longus and the flexor digitorum longus, you'll have a neurovascular bundle which travels in a tunnel known as the Tarsal Tunnel, and this neurovascular bundle is composed of the posterior tibial artery with usually two posterior tibial veins, and then the tibial nerve. The tibial nerve will further subdivide into medial and lateral plantar nerves, the medial plantar nerve being more medial and anterior, and the lateral plantar nerve being more posterior and lateral. And then as it extends distally, it will further subdivide into more distal, smaller branches. Along the anterior compartment of the ankle, we see the extensor tendons, and those are held in place above the level of the tibial joint line by this thin strip of tissue. This is the superior extensor retinaculum. We'll have an inferior extensor retinaculum that will originate more distally, and it will also insert into the sinus tarsi, and we'll see that best on our coronal and sagittal images. But this, above the level of the tibial joint line, is the superior extensor retinaculum. Now, the main tendon here is the tibialis anterior tendon, which will insert into the medial aspect of the first cuneiform. You also have the extensor hallucis longus and extensor digitorum longus tendons. Occasionally, you'll see a separate tendon that will insert into the dorsal aspect of the proximal metadiaphysis of the fifth metatarsal, and that is the peroneus tertius. Now, here we see the tibialis anterior inserting into that medial margin of the first or medial cuneiform right there. Now, traveling within the anterior compartment deep to the extensor retinaculum, we see the dorsalis pedis artery, we have an associated vein, and also branches of the deep fibular, also known as deep peroneal nerve. Now, the superficial peroneal nerve will travel anterior to the extensor retinaculum, and it's usually these little small branches that we see traveling distally within the subcutaneous fat. And then finally, the other main neurovascular bundle that we see is posterior laterally. This is the sural nerve, and traveling next to it is the small saphenous vein. And this is a nerve that is often used by our neurosurgery colleagues for nerve grafts. Now, finally, let's review the ligamentous anatomy. Again, we're above the level of the tibio-tibial joint line, so we're getting to the region of the distal tibiofibular syndesmosis. And the first ligament that we see is this thin ligament that connects the fibula to the distal tibia. This is the interosseous ligament. Just proximal to the level of the tibio-tibial joint line, we'll see another band of tissue connecting the lateral malleolus to the anterior lateral margin of the distal tibial epiphysis. This is the anterior inferior tibiofibular ligament, and we have a posterior inferior tibiofibular ligament. If we extend distal to the level of the tibio-tibial joint line, we'll see our lower lateral ankle ligaments. This is the anterior talofibular ligament. This is the posterior talofibular ligament. And then finally, forming kind of like the floor of where the peroneal tendons travel and extending from the distal tip of the lateral malleolus into the lateral border of the calcaneus, this is the calcaneofibular ligament on the axial images. On the medial side, we'll see the deltoid ligament. Now, the deltoid ligament will have different components. There will be superficial components and deep components. The superficial components are the tibiocalcaneal, the tibionavicular, the posterior superficial tibiotalar, and the tibial spring ligament. Now, on the axial images, they kind of all blend together. The deep layer, which is intra-articular and is covered by synovium, is composed of the anterior tibiotalar ligament and the posterior deep tibiotalar ligament. But again, most of these kind of blend in together on the axial images. The one that you can often track nicely as it travels lateral to the posterior tibial tendon is the tibial spring ligament, and that will then blend into this structure, which is again very, very important for maintaining stability of the midfoot and the arch. And this is the spring ligament. Now the spring ligament will have itself different components. This is the superomedial segment of the spring ligament, and as we travel more inferiorly, this is all spring ligament here. As we travel more inferiorly, we see the inferior components of the spring ligament, which are the medial plantar oblique and the inferior plantar longitudinal components of the spring ligament. As we extend further still, we see plantar calcaneocuboid ligaments, also known as the short plantar. There's a short and there's also a long plantar ligament. Again, these are the short and long plantar calcaneocuboid ligaments here. Now, along the far plantar aspect, when we follow our peroneal tendons distally, we talked about the peroneus brevis inserting into the base of the fifth metatarsal. But what happens is that the peroneus longus will make a turn deep to the cuboid and it will insert into the lateral base of the first metatarsal. Where it travels along the plantar aspect of the cuboid, this is known as the cuboid tunnel. So we nicely see the attachment of the peroneus longus into the lateral base of that first metatarsal. So we covered that first metatarsal as an important landmark for attachment of the peroneus longus. We talked about the base of the fifth metatarsal and its tuberosity as important sites of attachment of the peroneus brevis, as well as the lateral cord of the plantar fascia, and occasionally dorsally we'll see the peroneus tertius. And then finally, another important landmark is the medial base of the second metatarsal, because from it there is a ligament which arises in it and goes medially to attach into that first cuneiform. This is known as Lisfranc's ligament. And Lisfranc's ligament has itself three components. There is a dorsal, an interosseous, and a plantar component that we don't see to advantage on our routine field of view for ankle. For that we would need a dedicated midfoot. So moving on to the coronal images, these are coronal proton density images of the ankle. We're starting posterior and we're going to work our way anterior. So this is the distal tibia, this is the fibula, here's the calcaneus. As we extend more anteriorly, we see the talar dome. This is the posterior subtalar joint. This is the susentaculum talus, making that middle subtalar joint. And then more distally and laterally, we see the anterior subtalar joint. So this is the talar head and neck. This is the navicular. We went from the body of the calcaneus into the anterior process and finally into the cuboid. And as we extend more distally, we see that keystone configuration, this arch, Roman arch configuration, the cuneiforms, first, second, third cuneiform, cuboid, and then we get to the level of the basis of the metatarsals. So starting posteriorly on the coronals, we really don't see the Achilles tendon to advantage, but we can follow along the plantar aspect of the calcaneus, the plantar fascia. And the plantar fascia has three components. There is a medial cord, there is a central cord, and a lateral cord. The central cord being the most robust of the three cords, and they all attach here. As we look at the intrinsic muscles of the foot, we'll see some muscles are intimately associated with some of the structures we already discussed. So along the dorsolateral aspect of the calcaneus, we see the extensor digitorum brevis. The extensor digitorum longus are going to be these long tendons that cross the tibiotalar joint line and extend distally. This is the tibialis anterior, and this is the extensor hallucis longus. So this here being the extensor digitorum brevis. Along the plantar aspect of the calcaneus, plantar medial aspect, we see the quadratus plantae muscle, which is one of the intrinsic muscles. And then the other three main intrinsic muscles of the foot at this level are intimately associated with the plantar fascia. So just deep to the medial cord of the plantar fascia is the abductor hallucis. Deep to the central cord of the plantar fascia is the flexor digitorum brevis, and deep to the lateral cord of the plantar fascia is the abductor digiti minimi, also known as the abductor digiti quinti. So abductor, not adductor, abductor. Between the intrinsic muscles of the foot, we can follow the plantar neurovascular bundles, so medial and lateral as they travel distally. So here's the medial, and then the lateral plantar neurovascular bundles extending distally. Now, also going from kind of like medial to lateral on the posterior-medial aspect, we see the tendons that we already saw on our axial images. So this is the posterior tibial tendon. This is the flexor digitorum longus, and this is the flexor hallucis longus. The flexor hallucis longus will travel along the plantar aspect of the sustentaculum talus. Eventually, the flexor digitorum longus and flexor hallucis longus tendons will cross right here. This is known as the masternut of Henry, which we mentioned previously. Now, here's the posterior tibial tendon, and medial to the posterior tibial tendon, we see portions of the flexor retinaculum. And as we extend more distally, we'll see the main attachment of the posterior tibial tendon to that medial border of the navicular. Now, this structure that's just lateral to the posterior tibial tendon is the deltoid ligament complex. And again, we mentioned the different components. We just have to trace to see where the individual fibers are going, if they're traveling between the tibia and the talus, or between the tibia and the calcaneus, or between the tibia and the navicular, to see the individual components. But we can also nicely follow this structure here, which is a component of the deltoid that goes towards the spring ligament, and this is known as the tibial spring ligament. When we get to this level, just lateral to the navicular insertion of the posterior tibial tendon, this structure here is the superior medial segment of the spring ligament. And then as we go more distally, we start seeing the inferior fibers of the spring ligament proper. Now, as we extend more posteriorly and look laterally, we start seeing the perineal tendons. And so there is the fibula. And so here are the two perineal tendons coming down, and we can see portions of the perineal tubercle between them there. And the one that travels medially will be the peroneus longus that will insert into the base of the first metatarsal, while the peroneus brevis will travel distally to insert kind of like dorsolaterally into the tubercle at the base of the fifth metatarsal. Laterally, we'll see a few ligaments. So again, above the level of the tibial joint line, we'll catch the posterior inferior tibiofibular ligament here. We have the anterior inferior tibiofibular ligament here. And then distal to the level of the tibial joint line, we'll see the lower lateral ankle ligament. So we'll see the posterior talofibular ligament here. We'll see the calcaneofibular ligament here, and the anterior talofibular ligament here. Now, on our sagittal images, starting posteriorly, we have the Achilles tendon. We have portions of Kager's fat pad, which is this fat pad which is anterior to the Achilles tendon. We see portions of the soleus muscle belly contributing to the Achilles. This is the tibia, the talus, the calcaneus. This is the anterior process of the calcaneus, the cuboid, the calcaneo-cuboid joint, and here are the bases of the metatarsals, as well as the lateral, intermediate, and medial cuneiforms, and here we see the navicular. So going along the medial aspect, just behind the medial malleolus, we see the posterior tibial tendon. And the posterior tibial tendon travels right next to this indentation, or this groove behind the medial malleolus. And these little protuberances are known as the colliculi. This is the anterior colliculus, and this is the posterior colliculus. And we see portions of the deltoid ligament complex arising from them. So the posterior tibial tendon is intimately associated with that posterior colliculus, which is right there. And you see nicely its main attachment into the medial aspect of the navicular. Just posterior to that, we see the flexor digitorum longus. And then a little bit more laterally, we see portions of that flexor hallucis longus tendon that travels again deep to the sustentaculum talus and behind the talus here. This patient happens to have an ostragonum. This is the posterior subtalar joint, and again anterior laterally is the anterior subtalar joint, and then more medially is the middle subtalar joint. Now, this is the area of the sinus tarsi, and we see very important structures that travel there, This is the inferior extensor inoculum, goes into the sinus tarsi. This is the interosseous talocalcaneal ligament here. And then finally you have portions of that cervical ligament right here. So those are the three main components that are within the sinus tarsi, in addition to the nerve to the sinus tarsi, small arteries and veins. Now finally, arising from the anterior process of the anterior tip of the anterior process of the calcaneus, we see what is known as the bifurcate ligament. The bifurcate ligament has two components. It has a calcaneocuboid component here, and it also has a calcaneonavicular component here. And this is the bifurcate ligament. Occasionally you'll see small fractures involving that far anterior margin of the anterior process of the calcaneus involving the attachment sites of the bifurcate ligament. And then just along the plantar aspect of the navicular, kind of holding that talar head in place, we see our spring ligament, portions of our spring ligament complex here. The structure right there. And then finally, we can see our different cords of the plantar fascia. And then depending on which position we are, the lateral, the central, the medial cord, we can see either the abductor digiti minimi or quinti. We can see portions of the flexor digitorum brevis. We see portions of the quadratus plantae. And then finally, more medially, we can see portions of the abductor hallucis here.